Occupational therapists, or OTs, rehabilitate patients that are incapacitated or have a physical ailment or disorder. Normally, OTs start out their day by evaluating their patients' past medical records, assessing their patients' current circumstances, and generating a regimen. They also examine the patient's home, work, or school environment to identify things that could be worsening their circumstances or conditions so they can educate the patient, the workplace, or family of how to better assist them. Registered nurses, or RNs, treat patients and inform them of their medical issues. They also give guidance and counsel to patients and their families. RNs start their day by evaluating their patients, documenting changes or symptoms, and provide any treatment and medication necessary. The majority of RNs work under a doctor, and in that case, they would need to take counsel from a physician to decide on a health plan. RNs that work in nursing homes supervise licensed practical nurses and nursing aides and only consult with doctors as needed. Some occupational therapists work in care facilities or hospitals. Others work in schools and some in offices of their own. Being an occupational therapist requires frequently being in a standing position and lifting both patients and heavy machinery. Some OTs travel from one medical office to another, and even doing outpatient where they visit the patients in their home. OTs that work in facilities will normally work full-time day or evening shift, accommodating the time of day where people are already most active. A registered nurse could work in a nursing home, under a physician at a hospital, as an independent contractor doing home health care, or with enough flexibility, they can be a travel nurse, going to different cities or states, filling in for facilities that are understaffed. Like OTs, nurses spend a lot of time on their feet, standing, walking, and lifting. Nurses also carry a risk of being exposed to patients with communicable illnesses and being exposed to unsafe materials. It is a requirement that occupational therapists have a license to practice. After obtaining a bachelor's in health or science-associated sectors, they must pursue a master's degree, which takes between 2 and 3 years to complete. The majority of employers prefer that new OTs gain experience in a healthcare setting by becoming a mentee. In addition to this, once certified, therapists must continue to take sporadic classes to preserve their licenses. Registered nurses need either an associate's or bachelor's in nursing, or a diploma in an accredited nursing program. Both bachelor's and associates in nursing take 4 years to achieve, and the diploma takes between 2 and 3 years to accomplish. After school, to obtain a nursing license, nurses must pass what's called the NCLEX, which determines a nurse's capability to supply practical and suitable care to a patient. After gaining experience as an RN with ongoing training, nurses may work on the business side of healthcare or even become a teacher. As with any occupation, salary varies depending on location of employment. With occupational therapy, it also varies with which setting the therapist is employed. Studies published in 2021 showed a range of salaries for occupational therapists that was between the lowest at under $60,000 annually and the highest at over $123,000 annually. The highest paid OT worked in a home healthcare setting, and the lowest paid OT worked in a school. The average earning for RNs in 2021 was a bit over $77,000 a year, with some nurses making below $60,000 and some nurses making above $120,000. Nurses in hospitals and nursing homes usually work in consecutive 8 to 12-hour stints to have 24-hour care for the patients. And in hospitals, nurses will sometimes be on call or PRN, in which they would be expected to come in and fill in shifts at a moment's notice. Occupational therapists are in a high demand, partly due to the growing number of people with ailments that seek to remain independent, and partly due to OTs transitioning into other fields or retiring. Approximately 10,000 opportunities open each year for occupational therapists. From the year 2021 to the year 2031, the number of OTs are expected to grow from 133,900 to 152,500, and that's a 14% growth rate. Registered nurses are now and will continue to be in high demand. Over 203,000 nurses positions are predicted to be filled each year. The demand will only grow due to the growing number of elderly people who have medical problems and patients who become obese or diabetic. The amount of RNs employed in 2021 was recorded to be 3,130,600, and the projected amount to be employed by 2031 is 3,326,600, and that is a 6% growth rate. Both occupational therapists and registered nurse work very close with patients and are trained and expected to not only be able to perform the duties in their job description, but also to be able to build rapport, to be able to better communicate and properly motivate their patients. They also can work in any environment, such as homes, hospital, and medical offices. With either field of study, a person could easily transition to other medical fields with continuing education. Most importantly, OTs and RNs specialize in bettering patients' health and educating them to how to adapt to healthier lifestyles choices so that they can live a longer and more independent life.